welcome back. Daily Show hitting you at 9:18. Getting warmer out there, 27 degrees, Doctor. Joining us in studio is Dr. Kishore Harjai, who is the Director of Division of Cardiology with Salute Care SSM Health. Did I get all that right?
You got it.
I was nervous. It was a nerve-wracking couple of minutes here, Doctor.
You did wonderful, CJ.
Speaking of hearts, man, mine was pumping when I was trying to get that one out. You know, a little nervous there. Well, and it's always a good time when we're talking about ways that we can, keep watch of our heart health, because it's one of those things, especially, around here, a rural area, we hear of the deer hunters that are going out and, every once in a while having a heart, episode of some sort. And then, here at our, own homes, it can happen at any time. And what better time to talk about really just taking care of ourselves and watching it.
Right. So, heart health, it's mostly about taking care of our lifestyle. It's about taking care of any risk factors that we may have for heart problems. So the commonest risk factors, as you might know, are smoking.
Yep.
That's a really, really big one. High blood pressure, diabetes, high cholesterol, and also family history, which is really if any of your first-degree relatives have had heart problems before the age of 55 or 60 years. So all of those kind of merge together to cause heart problems. Mm-hmm. And as long as we are conscious about which risk factors we have, and we take care of those by going to our physicians, taking our medications as prescribed if we have any of those risk factors, and really, really just maintaining a very active and healthy lifestyle, which includes dietary habits, walking, doing, steps every day. So those are the things we can do to prevent any untoward heart attacks.
Just a quick follow-up to that, too. Sometimes I feel like as people, we think, we're maybe more active than what we are normally. Where maybe we think, well, we got up and we, did our daily activities, but I'm still having these, sort of effects. I'm still not feeling the best. Is it really important to kind of monitor or do a little bit more if we're, still as tired or we're still not as active, as we should be, even though we're doing those daily activities that we've come to, grow a part of our routine with?
Right. So when we talk about activities, it's beyond what you would do as part of your job or household chores. By activity, I mean doing about 30 to 40 minutes of moderate activity several days a week, say 4 days, 5 days a week. And that could mean just going out for a brisk walk. It could mean going to the gym. It could be trying to accomplish 10,000 steps a day. It could be, weightlifting, being on the treadmill, doing the elliptical, swimming. That's what I mean by activity. Just doing one's daily chores. It's really not enough, because when we do our daily chores, we start and stop, and we start and stop, and we actually never give our muscles or our heart any exercise, so to speak. So having sustained activity for 30, 40 minutes a day is really helpful.
Well, I'm glad I asked that too, because, that really does become, especially with the conversations I have with my, family and friends, we go, man, we had a long day. I cleaned the whole house, and it becomes, what I'm talking about, it becomes this big deal, but it goes a lot further than just, doing the things we need to do. We need to be proactive, and we need to go out a little bit more than above and beyond to take care of our bodies.
Right. And also making sure we are eating the right stuff.
True. Keeping
our caloric intake in check.
And not drinking these.
Not drinking those for sure. I don't drink those. I drink coffee though, which is not. Coffee is not bad for the heart anyway. So, but keeping our weight in check, as you might know, about 65 to 70% of the U.S. population is either obese or overweight, and we got to really make sure we keep our weights in check by limiting caloric intake and increasing physical activity. When we do all that, the other risk factors tend to get better. So even if you have high blood pressure or diabetes or high cholesterol, keeping the weight in check, keeping the caloric intake under control, those things actually help the risk factors. As and on top of that, you may have to take your medicines as well.
Well, and when you're working with, or your division is working with, a patient that maybe is coming in that has a couple of different risk factors that are brought on by maybe a lack of active lifestyle. Maybe it's because of their poor eating habits too. when they start to work on those, what I find fascinating, because we talk a lot about mental health on this show and just how it kind of goes into our overall health too, whenever they start working on those, daily being more active, when they're focusing on their diet and they're starting to see these changes, do you see an overall mood improvement with those patients 9 times out of 10 for a good percentage?
Yes. In a good percentage of patients, we will see an improvement in how they feel, being less depressed, being less anxious, being more upbeat, because physical activity releases certain chemicals within the brain, the endorphins, so to speak. And the more intense the exercise, the more the endorphin releases, and people feel happier, more grateful for what they have, and generally less down when they are more active.
And, on following up on that too, when you're working with those patients, what is it like to see them, coming in, if they're really following this and they're really working hard? Do you see that kind of reflection just on their outer personality, just in the day-to-day demeanor, when, when the moment you first met them, they first came in your office to, maybe a couple of months down the road after, getting some work done, going through maybe a annual checkup, they come back. Do you see any difference just on the outside or external side of things with your patients when it comes to that?
In fact, we do. In fact, that's one of the most gratifying things we see in patients, not just the fact that their blood pressure is controlled, their diabetes is good, their cholesterol numbers are good, but how they actually feel. And a lot of times that shows in a patient. They're smiling more when they come into the office. Their spouse is happy that you've been able to take care of them, so that their children with them, that's very gratifying to see an overall improvement, not just an improvement in the numbers, not just prevention of a heart event down the road, but an improvement in how they feel when they come to the office.
Well, and you mentioned family and support system a bit there, and I wanted to ask you, whenever you're working with someone who doesn't necessarily, maybe they haven't had a heart episode yet, but there's risk factors there and there's some troubling signs, can they make it almost to where it's a family event where, we're getting active together, or we're going out and spending more time together outside, or going to the gym together? Have patients use that as kind of not a coping mechanism, but almost as a tool to keep this routine going?
Yes, that's a wonderful question. That's a great thought. First of all, just having that support system improves the prognosis of patients. That's been statistically shown over and over again, that people who have less loneliness in their life, who are surrounded by family and friends and social circles, actually tend to do a whole lot more, a whole lot better. Whether they've had a heart attack or not, whether they've had a stroke or not, they live longer, they live happier lives. And in terms of doing things together, that's a phenomenal idea. I think goals, whether it's a goal of walking 10,000 steps or losing certain number of pounds or putting less salt in your food or quitting smoking, all those goals really work well if everybody living within the same household adopts those goals and they go ahead with it together. Then it becomes a shared mission instead of a single person's mission.
Well, and and that's something I wanted to bring up too, because a lot of times we think of certain battles as kind of village battles where we call on our supporters, but even something like this, to where it could just be daily habit changes that lead to a better overall life. Why not get preventative maintenance going early and do what you can do? I talked a little bit ago with somebody else from OSF. I forget who, but it was a great conversation about strokes is what we were talking about, but also the rise of maybe heart episodes or heart issues with younger people. Have you seen that in terms of your care and just some of the work that you're doing?
Yes, we have. The age at which heart disease affects people keeps on going lower. Younger people are affected. And I think much of that is related to the epidemic of inactivity that I see. The more we tend to stay indoors or avoid outdoor activities, the more inactive we become, the more weight we tend to gain, the more we tend to snack on unhealthy foods, sitting around, the more we drink stuff
energy
like that.
drinks. Yep. I'm trying to quit, doctor. I'm trying. And
each one of those things has a cumulative impact on lowering the rate at which people start developing heart disease.
And something I'm always curious about, and I know that, sometimes you can't really, sometimes things just happen, but when it comes to heart issues and maybe heart attacks just at large, are there true warning signs like, maybe somebody's arms, getting tingly for a couple of days, or there's some circulation issues there, or there's some lightheadedness? Are there any, I don't want to say common, signals, but is there anything that you've kind of seen over the course of your career where you can interpret that as an early sign that something's looking wrong?
So there can be warning signs, but there is not always warning signs. So the commonest warning signs for patients or individuals who are developing blockages in the heart arteries over a period of time, those blockages get worse. The commonest early signs are feeling some chest discomfort or breathing difficulty with physical activity. So it would be like, I could walk 2 miles in 35 minutes, but now if I try to do that, I start getting this a little ache in my chest, or I start feeling short of breath. I can still do 2 miles, but it's not 35 minutes. Now it's taking me 55 minutes or an hour, or it would be like, I was able to vacuum the house. Now I have to stop 2 or 3 times. I was able to mow the lawn, but now I have to stop. And so a lot of times the family members are more tuned in to the fact that the individual is slowing down than the individual themselves might be. So that would be the warning signs. Yet, one cannot rely on having warning signs because a lot of heart problems do occur without previous warning signs. There are sudden incidents of a heart attack, sudden cardiac death. So it's really important that we see our regular primary care physicians at least a couple of times a year, especially after we hit the age of 40 years, because that's when the screening has to occur. Do we have high blood pressure? Do our blood tests show diabetes? Do they show high cholesterol? A lot of those things have no warning signs.
And see, this is why I just find it so fascinating, because every time we have a conversation, I hope even if just one person goes, you know what, I haven't made that appointment yet. I need to go do that. If we can do that for one person or two today, I think it's a good conversation. With that being said, do you have a moment to stick around?
Yes, I do.
We're going to take a quick break, and I'm going to pay a quick bill here at 9:30 on the nose. It's the 10th day of February right here in the heart of the 618. You're listening to our daily show on RiverBender.com, Roku TV. We'll be right back after this.
Oh no, another bad headache?
Yeah.
Maybe it's time to see your doctor.
OSF Healthcare can handle all of your family's primary care needs, including diagnosing health issues or referring you to a specialist. Schedule an appointment today.
No matter the season, Play It Again Sports in Edwardsville has the gear the athletes need to get in the game. Whether you're shopping for the newest sports equipment or saving money on quality used gear, Play It Again Sports carries what you need to maximize performance to get the most out of every swing, kick, stroke, or shot. We'll even buy your used goods, paying cash on the spot. We carry all the gear for all the sports all year long. We're your hometown sporting goods store. Play It Again Sports, conveniently located at 4 Club Center Court in Edwardsville.
Yo, what up? It's Mike Keith, the proud graduate of Lewis and Clark Community College. I got my start in broadcasting and now I work all over the country. I discovered my path in media, but I could have been an electrician. Or I could have been a nurse.
Maybe not.
Get paid to go solar.
We're not solar bros. At Grid, we're solar pros. We explain the process behind solar power so you can make an informed decision. We'll work with you to make owning your power as simple as possible and affordable with zero down financing and payment options. Our only goal is to save you money. Call Grid when you're ready to be independent of the power company.
Looking for the best barbecue in Madison County? Head over to Carver's Barbecue in Godfrey, Illinois. From loaded barbecue nachos to mouth-watering pulled pork, brisket, ribs, and more, Carver's serves up award-winning flavors you'll love. Family-owned, Carver's is all about fresh, made in-house dishes served daily. Come visit us at 2716 Groveland in Godfrey, or give us a call at 618-467-9999. Order online, get it catered, or stop by for the best smoked meats around. Where great flavors meet family tradition, you'll find Carver's Barbecue.
Since 1993, Sparks Junk Removal is always adapting to the needs of our clients. That is why we now offer weekly trash pickup for selected areas. Plus, we offer driveway-safe rubber-tired dumpster rental. Give us a call today at 618-781-1407 or visit us at sparksjunkremoval.net.
You're listening to Our Daily Show with CJ Naselli on RiverBender.com.
With my best old ex-friend Ray. Gosh, she said she knew well and sometimes hated. But isn't that the way they say it goes? Well, let's forget all that and give me the number if you can find it.
The time is 9:34 on this 10th day of February. You're listening to Our Daily Show, or you're watching us on Roku TV. Welcome back. Dr. Kishore Harjai, Harjai.
You got it.
I did?
Yeah.
I was in my own head again. See, I just need to keep going with the flow, doctor. I was ready. Yeah. Oh, man, Randy's going to be laughing at me when I get done with this one. But we're back in studio, and we're having this really important conversation about our heart health. And, before we go diving back into what we can do, take me through your role and just what you do as director, within the systems.
So as director, my role is to make sure, first of all, that patients who are touched by St. Anthony's and SLU Hospital get the best possible care they can get. That's fundamentally the major role, is to make sure patients are happy and get the world-class care. In that role, I also recruit several other physicians, nurses, nurse practitioners to expand our ability to touch patients' lives, provide access either in the clinic or as an inpatient when they're admitted to the hospital, or be able to read their tests in good time, quickly, whether it's an EKG or an echocardiogram, do procedures like heart catheterization. So the director role oversees several aspects of that. In our team, we currently have 12 physicians, 4 advanced practitioners. We have 15 trainees, and we have about 10 to 12 nurses overall to help deliver that care.
Well, and with that being said, how important is it to have everyone that's affiliated within that division and a part of the team, well equipped and well versed, and also always learning? Because it seems like, you have your, obviously there's so many types of heart episodes and encounters you have with patients, and it seems like you have to react within a tenth of a second sometimes to determine the proper treatment path for someone.
Right. So training and equipment are two important things you touched upon. The training part is, it's crucial. We take the training of our trainees. We call them cardiology fellows.
Okay.
A fellow is somebody who has finished the training to be an internist, but now they are training for 3 more years before they can become a cardiologist. Wow. So we have our cardiology fellows. We train them in various aspects of healthcare. At SLU Care, we get a lot of very complex patients. And in Alton, we have patients who are seeing a cardiologist sometimes for the first time. We screen patients and take care of them locally with ultrasound of the heart, stress testing, heart catheterization. In fact, I just did a heart catheterization earlier today. We look for valve problems and address valve problems. And in being here, the idea is that we take care of patients closer to their home. Yep. However, when the problem demands tertiary or quaternary level care, subspecialty care, then we are available to transition them to a higher level of care at St. Louis University Hospital.
Well, and you just almost had a crystal ball over there, because that played right into what my next, kind of topic was going to be, is the fact that, for so long, a lot of generations, the older ones, maybe my grandparents' generation and even some of my parents' generation, were used to a world of driving to St. Louis for everything when it came to appointments, or maybe even, some of those tests that you can do now here at St. Anthony's. How important is it to have those type of, that type of procedural work at St. Anthony's and that type of system to make sure that your overall, the bigger, people, the bigger cases aren't, getting time constrained? Because that's where I think it comes into is such a big fold, is the fact that you have all these network hospitals that can do some of this to alleviate the bigger, your guys' bigger networks.
Right. So, every every question for me fundamentally boils down to, if I was the patient, what would I want?
Right.
That's where it begins. And what I would want is what we are striving to do here is take care of most of the problems locally. Yeah. Take care of patients closer to home, so their family is closer to them. They're able to visit with the family, and then be very cognizant that a lot of treatments require a higher level of care. So, for example, right now, at this point, most of the diagnostic testing that is necessary for the heart, such as ultrasound of the heart, EKG, heart catheterization, stress testing, and in many cases putting stents in the heart, all of that can be done at St. Anthony's for our local population, for our community here. We are also on the cusp of acquiring a special CAT scan and a special MRI, which would be focused on the, we have CAT scan and MRI, but the ones which are focused primarily on the heart, we are on the cusp of acquiring those technologies. We also have subspecialists from my group who come here and provide other treatments like putting pacemakers in the heart. And we've started a program recently to help patients with leg blockages. One of our colleagues, Dr. Arora, is highly subspecialized in taking care of leg blockages.
That's a big topic right now, too.
And there is a lot of prevalence of blockages in the leg arteries. Sometimes the blockages are so severe and they've been there so long that patient's foot or leg may be threatened and may eventually require amputation. So the goal of providing that treatment is we get to the blockages before they actually require amputation. And a lot of that we are able to do here. However, certain things require patients to be transferred to St. Louis University Hospital. For example, patients who need bypass surgery, or patients who need valve surgery, or even catheter-based valve interventions like TAVR, that's transcatheter aortic valve replacement, or they need catheter-based treatment for the mitral valve called mitral clip. For those, or if they need stroke prevention strategies for patients with atrial fibrillation, those kind of treatments, we do have to bring patients to St. Louis University Hospital, either electively as an outpatient. Sometimes it is an inpatient transfer, and we try to do that as seamlessly and effortlessly, so the patients at the end of it have not just a great outcome, but also a very pleasant experience.
Well, and, getting into that, just to follow up a little bit more on complex needs, how often, how often would it be where a patient comes into, maybe a St. Anthony's with what they perceive maybe just a simple, chest issue, where there's just something going on that doesn't seem right, and it ends up with a transport over to Sewell Hospital? Does that happen quite a bit?
It happens a fair bit.
That's what I was curious about.
It happens a fair bit. I would say, if you look at an average month, there is probably 10 to 15 times that we have to transfer a patient from St. Anthony's to St. Louis University Hospital. And the fact of the matter is that even though the population at Alton is smaller, however, the amount of disease we see is quite advanced.
Yeah.
So we don't see disease very early on. In fact, the first question that you started the interview with is very relevant here. How do we... It is better to identify problems early on. It's better to identify problems when they're mild to moderate rather than when they become very, very severe. So those are challenges we face on a daily basis.
Well, and that's what I wanted to end the conversation with today on, is how we can really start to take control of this. And it's one of those things where, my grandpa started a sewer business and he came up with this term preventative maintenance. And I use it all the time because preventative maintenance goes a long way with our lives and everything we do. What can we do, as we're getting older? I'm 26 years old or 25. I don't even know how old I am anymore, but 26 years old. And, for people that are maybe getting into the early 30s, they're getting to that 40-year-old mark. What can we do to start making sure that, hey, if something is going a little bit elevated or out of control, we can hone it in early and prevent some major issues from happening?
Great. Yeah. So what your grandfather called preventative maintenance, we have a slightly different word when it comes to the body. We call it primary prevention. So primary prevention basically means you do preventative maintenance before you have the first major event.
Yeah.
So the first major events would be heart attack, stroke, or having leg blockages to the point that the leg needs to be amputated, or death in the worst case scenario, right? So primary prevention means acting before any of those happens. And it again boils down to what we started this the talk with. It's lifestyle factors. It's making sure we don't smoke, making sure we drink zero to minimal amounts of alcohol, because alcohol also has bad effect on the heart in many, many ways and causes several kinds of cancer. Making sure our blood pressure is controlled, diabetes, if we have diabetes, making sure our glycosylated hemoglobin is less than 7 or less than 6.5, making sure that our cholesterol levels are controlled. We are active, we are not overeating, we keep our weight in check. That is the preventative maintenance for the human body.
Just a brief follow-up on that, because about smoking, because so many times, especially in my life and people that are around me, you get the story of, what you ever think about stopping? Well, I've been smoking for 15 years, CJ. Why would I quit now? It doesn't matter how long you've smoked for. If you like, and when it comes to getting back to proper lung health and cardiovascular health, because to me, I'm thinking even if you smoked for 20 years and you're 60 years old, well, if you stop smoking now by 70, you should be feeling pretty darn good. I don't know anything. I don't know about this. That's why I figure I'd ask you, is there a point to where stopping smoking is not going to help somebody?
I don't think so. Stopping smoking at any stage in your life is going to have tremendous impact. There is a lot of data out there that within 3 to 5 years of quitting smoking, the risk of cancers and heart disease comes down to that of a non-smoker.
Wow.
Now, certainly, the more the years of smoking you have before you quit smoking, that does have a toll, that has an impact on the human body, whether it's the blood vessels of the heart, the blood vessels of the legs, the blood vessels going to the brain, they all get calcified and they start getting blocked the more years of smoking exposure that we have. Yet, quitting smoking at any age has tremendous benefits in the future.
Really good. And Doctor, thank you so much for your time today. And before I let you go, my final question is, how do we start this? If we haven't called our primary care provider, or we don't, maybe we haven't even gone to a doctor in a while, because I know some people are maybe falling into that category. What do we do first to get back on the right track with our own health?
So we got to start today.
Yeah.
Right? We got to start today. And it begins with starting today with walking, or exercising, watching what I'm going to eat for lunch, making sure I'm not putting too much salt, not putting too many calories in my food, and making an appointment with my primary care physician if I haven't seen them in a while.
There you go. Doctor, thank you so much for your time today. Really appreciated the conversation. You can learn more about all the benefits that await you at OSF Healthcare by going to osfhealthcare.org/St. Anthony's. We'll take a quick break. We'll link this conversation on RiverBender.com later. You stay there. We'll stay here on RiverBender.com and Roku TV.